मैं emphasize करूँगा chronic stress, sleep deprivation and social dissociation.
Our focus in Indian population is young heart attacks. How can we prevent heart attacks in this productive age group and the whole bread earners? So those cases, for that we should develop a AI-based algorithm which should help us to detect it early and do better.
Thanks to the pollution, even non-smokers are smoking about 50 cigarettes a day. So forget about smoking, vaping. Vaping is like a modern trap in technology.
Our guests for this episode are Dr. Naveen Bhamri, Vice Chairman, Cardiac Sciences, Max Super Speciality Hospital, Shalimar Bagh, New Delhi. Dr. Arun Mohanty, Director, Intravascular Imaging, Cardiology, Ganga Hospital. Dr. Amit Bhushan, Director and Head Cardiology, Interventional, Structural and Heart Failure Specialist, Paras Hospital, Gurugram.
Everybody at the age of 25 to 30, they should know their numbers. उनका LDL कोलेस्ट्रॉल कितना है, उनका ब्लड प्रेशर कितना है, उनका शुगर लेवल, फास्टिंग शुगर लेवल कितना है, उनका वेस्ट सर्कमफ्रेंस कितना है, because prevention start with awareness.
High risk population should get a CT evaluation. If you have 2-3 risk factor, you have a strong family background, you have some symptoms which are suggestive of maybe a cardiac issue, should get a CT or a echo.
If you can pinpoint a pain, it's here, it's not cardiac. Cardiac pain, you will not be able to pinpoint. 1 or 2 kgs of weight on your chest, severe sweating is going on, uneasiness, ghabrahat, bechani, those are the cardiac symptoms. And if you have that, give 325 milligram of chewable aspirin. चबा के दीजिए, अगर चबा नहीं सकते तो चम्मच में घोल के पानी से पिलाइए. उसके बाद this aspirin alone is going to save his life by about 22%. This is an NEJM WHO data.
Welcome to our special World Heart Day podcast. Cardiovascular diseases remain the leading cause of death worldwide, yet they are preventable through awareness, lifestyle changes, and timely care. Today, we'll explore insights, strategies, and stories that highlight how prevention, innovation, and hope can change the future of cardiac care. This episode is organized by Voice of Healthcare and supported by Polymed, with the theme Tackling the Cardiac Crisis, Prevention, Innovation, and Hope. Our guests for this episode are Dr. Naveen Bhamri, Vice Chairman, Cardiac Sciences, Max Super Speciality Hospital, Shalimar Bagh, New Delhi. Welcome, sir.
Thank you.
Dr. Arun Mohanty, Director, Intravascular Imaging, Cardiology, Ganga Hospital. Welcome. Dr. Amit Bhushan, Director and Head Cardiology, Interventional, Structural and Heart Failure Specialist, Paras Hospital, Gurugram. Welcome. So my first question goes to Dr. Naveen. India is called the heart disease capital of the world. And that sounds scary. Are we really sitting on a ticking time bomb? And if I'm healthy, 30 years old, listening right now, should I be worried?
A very important question. Yes. India is often called the heart disease capital of the world. While that sounds dramatic, ऐसे लगता है कि हिंदी हॉरर फिल्म का कोई ट्रेलर है. But the fact underneath is our hearts, our heart is paying, our hearts are paying the cost of modern life. Yes, India is facing this epidemic. 25% of heart attacks generally occur in less than 40 years of age. And the science behind is we Indians are getting diabetes, high blood pressure, cholesterol a decade earlier than the Western counterpart. Our young generation, they sip green tea, they have six packs, they wear smartwatches, but inside their coronaries is ticking a time bomb. What is the reason? Is it a double burden? We are sandwiched between the genetic predisposition and the worst of Western lifestyle. सेकेंड, स्ट्रेस का ओवरलूप. हमारा यूथ जो है प्रेशर कुकर के अंदर है. फोमो, फियर ऑफ मिसिंग आउट, जॉब इनसिक्योरिटी, फाइनेंशियल बर्डन, टॉक्सिक रिलेशनशिप्स, डोपामिन एडिक्शन वाया रील्स, फिटनेस ट्रैप, fit outside, sick inside, overdoing, overusing of unregulated protein shakes. There are silent killers also. But मैं emphasize करूँगा chronic stress, sleep deprivation and social dissociation. Last question you have asked a 30-year-old guy who is listening this. डरने की बात नहीं है, समझने की बात है. अगर वो गुड हैबिट्स को फॉलो कर रहा है, if he is eating good, he is eating right, Right means complex carbohydrates, proteins, unsaturated fats, but in a proper proportion. If he is doing exercise every day, at least 150 minutes in a week, he is not addicted to alcohol, no smoking, proper sleep, then he is diffusing that time bomb. So at least it is good for him कि अगर 30 साल पे उसको पता चल रहा है कि ये प्रॉब्लम हो सकती है, so he can modify his addiction, he can modify his bad habits so that he could not be a part of that statistics later on.
सर आपने एक बहुत अच्छी बात कही कि समझने की बात है और मैं पूरी इस बात से एग्री करती हूँ. So, Dr. Arun, you work with the, intravascular imaging every day, which gives you a window into the arteries of the heart. If you could scan every Indian today, what do you think you would find? Are we walking around with silent blockade we don't even know about? And can AI and new technology catch them before disaster strikes?
Yeah, it's a nice perspective. I do imaging, but unfortunately, those imaging are for treatment, not for diagnosis, not recommended for diagnosis, routine diagnosis. But what we get, we Indians particularly, our arteries they get atherosclerosis or blockages or deposit of cholesterol as early as 18 20 years. This is alarming. This is because of, as Dr. Bhamri was telling, different risk factors. We are genetically predisposed. So sometimes we see the plaque and we characterize the plaque or blockages inside the artery, whether it is vulnerable for a heart attack
Hmm.
or it is a stable thing. That's how our imaging is helping. But it cannot be a routine tool to everyone. If I say, uh, if you take a high risk population and do imaging to our imagination, at least one third of the population beyond 25 years of age will have some kind of atherosclerosis. For that, AI is coming in a very big way. And before discussing AI, we must integrate AI to our understanding, our application. We should not be slave to AI.
Hmm.
AI should not dictate us what we should do or not. So, what way? There are three, four parameters which are coming up in AI today. All our intravascular ultrasound or optical coherence tomography, where we can see practically a histopathology of the artery, which we see under microscope. They are so good, and they are AI integrated. They can tell about your plaque vulnerability, whether this plaque can cause a heart attack or not. But now we have better tools like CT scan, which are integrated with AI. A CT coronary angiogram in a high risk population can give you this plaque is stable and the other one is not. This guy has a high risk feature. So there are different features for high risk vulnerability. Those plaques can be identified by CT scan. There are biomarkers coming up. Every one of us were using wearable smartwatches and all, which can give us ECG diagnosis. And ECG algorithms are being developed, which can tell you the dynamics of different changes to predict this guy is predisposed for an event, whether it's a arrhythmic event or a heart attack event. So this way the AI is helping us definitely. But there are biomarkers also available and all integrated. Now this can be a wonderful tool in the future, but we must integrate that to our understanding. We should not follow blindly to AI because AI can go absolutely wrong sometime, can cause panic among people. I get patients sometimes just because of watch, they'll see their heart rate pattern is so much high or some, they'll panic, and this panic gives them a psychosis. Now they will follow a psychiatry for that, this palpitation, this heart so you should not blindly follow that. You should follow with a symptom or something. You should integrate this data to clinical applications. And second thing, why it is important, whatever scores we have, like Framingham score, which is Western people have developed, or is atherosclerotic cardiovascular disease scoring system, they are practically for elderly population. They are not for younger individual. Now our focus in Indian population is young heart attacks. How can we prevent heart attacks in this productive age group and the sole bread earners? So those cases, for that we should develop a AI based algorithm which should help us to detect it early and do better.
Right. So we should not be slave to AI,
Yeah,
right? So intelligence is needed,
yeah,
and I
yeah,
think cardiologists
yeah,
are the best
yeah, yeah,
guide, and CT angiograms,
yeah,
all these
yeah,
there
yeah, yeah,
are there,
yeah, yeah.
right? So, Dr. Amit, You see patients from all walks of life, young, old, men, women. How much do you think smoking, vaping, alcohol, and recreational drugs really contribute to heart attacks? And what about women? Are they equally at risk? And do we often miss their symptoms because they show up differently?
Yeah, very pertinent question. Thanks to the pollution, even non-smokers are smoking about 50 cigarettes a day. So forget about smoking, vaping. Vaping is like a modern trap in technology. Fancy devices, youngsters are lulled into thinking that it's safe. Actually, it is as dangerous or even more dangerous than smoking. You have aerosols which hit the lungs, destroy the linings of the heart vessels, suddenly causing a clot, causing vasospasm or narrowing of the blood vessels. For example, younger patients have, as Dr. Mohanty was alluding to, have got a thin cap blockage, patli jhilli wali blockage. As compared to, let's say, parents or somebody who's about 60, 70, he's got a thick cap blockage. It's a stable blockage, gradually progressive. 50% will become 60% in about 10 years, 70% in about 20 years. While youngsters sometimes they have a thin cap blockage, 30% blockage. You have a weekend binge drinking, weekend marathon, weekend vape parties, and suddenly the 30% block ruptures, causing a 100% blockage, game over. So this is so even when it comes to recreational drugs, MDMA, ecstasy, cocaine, amphetamines, weeds, so they also cause narrowing of the blood vessels, arrhythmias, or sudden fastening of heart rates, and causing a sudden cardiac effect. One more thing I would add in this is to the cocktail mix is proteins, substandard quality of proteins. Gym trainers and dietitians are modern day quacks. पुराने ज़माने में नीम हकीम होते थे, दे आर मॉडर्न डे क्वैक्स. आप 20 अंडे खाइए, आप इतना प्रोटीन खाइए, and people are not mindful of the protein they eat. Even the best known brands, people will agree, are containing a lot of sugar, lot of, even if it's a sugar free thing, you'll have a lot of preservatives. The proteins are substandard, causing allergies, plus the testosterone supplements people are taking. So these things, pre-workouts. So pre-workouts, if somebody is a borderline hypertensive diabetic, taking a pre-workout on top of it, goes to the bar, it takes alcohol, sudden collapse, white froth coming out of the mouth. You have a 20-year-old kid working out in the gym, has a pre-workout, turns into a beast mode, exercises, goes to the bar, takes alcohol, and suddenly collapses. So this is a norm rather than exception right now. Coming to the second part of your question, ladies, so females, the traditional teaching was till the time they have their menses, they are protected from having a heart problem because of hormonal protection. But now, even that hormonal protection is going away thanks to oral contraceptive pills, multiple supplements. You have young celebrities. Recently, there was a Kanta Laga celebrity, Shivali Jariwala, who had a sudden cardiac arrest, even though she was young. So even young females are getting much more prone for having a cardiac ailment. But the key is they will not have a crushing chest pain. They will not have a classical angina. They will have something called as an angina equivalent. So angina equivalent could be shortness of breath, acidity, ghabrahat. Like shortness of breath, like an asthma, may not kill you. An acidity gas will not kill you, but a cardiac disease can be fatal. आप गैस गैस करते रहेंगे, थोड़ी देर में खुद ही गैस बन जाएंगे. So that is one.
Right. So I think modern day quack से हमें बच के रहना चाहिए and हमें again समझ की ज़रूरत है. So Dr. Naveen, we keep hearing about people collapsing in gyms, wedding, and at work. Are there warning signs before a sudden cardiac arrest? And can you share three practical things every listener can start doing today to lower their risk?
यू आर टॉकिंग अबाउट द सडन कार्डिक अरेस्ट, जो जिम में लोग मर जाते हैं, कोलैप्स कर जाते हैं, वेडिंग्स में जा रहे हैं. दिस इज सडन कार्डिक अरेस्ट. सडन कार्डिक अरेस्ट रेयरली कम्स आउट ऑफ नोवेयर. हार्ट जनरली विस्पर्स बिफोर इट स्क्रीम्स. तो कुछ वार्निंग साइंस हैं यू शुड नॉट इग्नोर. नंबर वन, if you're while walking, if there is a chest heaviness or there is some chest discomfort, don't ignore it. Second, if there are any unusual breathlessness or unusual fatigue, don't ignore it. Fainting spells, blackout episodes, palpitations, if any of these warning signs are there, ये मत समझो ये स्ट्रेस की वजह से आ रहे हैं और जैसा डॉक्टर साहब ने बोला ये गैस का सिम्टम है. नो, दे मे बी अ रेड फ्लैग साइंस. तो इनको आपको इग्नोर नहीं करना है. एंड फॉर द लिसनर्स, थ्री थिंग्स. वन, गेट योर नंबर्स चेक्ड. एवरीबडी at the age of 25 to 30, they should know their numbers. उनका LDL कोलेस्ट्रॉल कितना है, उनका ब्लड प्रेशर कितना है, उनका शुगर लेवल, फास्टिंग शुगर लेवल कितना है, उनका वेस्ट सरकमफ्रेंस कितना है, बिकॉज प्रिवेंशन स्टार्ट विद अवेयरनेस. सेकेंड थिंग, फिजिकल एक्टिविटी एंड अवॉइडेंस ऑफ टोबैको. ये दोनों चीज़ें आज भी बेस्ट शील्ड मानी जाती हैं. एंड थर्डली, लिसन टू योर हार्ट, डोंट इग्नोर योर सिम्टम्स, बिकॉज इफ़ यू इग्नोर इट यू विल लूज द गेम. सो ये तीन चीज़ें जो हैं ये सबको पता होनी चाहिए. एंड सडन कार्डिक अरेस्ट सडनली उन्हीं को होता है जो प्रिपेयर्ड नहीं होते, दोज हु आर अनप्रिपेयर्ड. इफ़ यू लिसन टू योर हार्ट विल नॉट स्क्रीम.
So listen to your heart, and smoking, I think, is one thing which is, there for ages. We should not do it, and that prevents the cardiac arrest and especially the inflammation associated with it. Right, Dr. Arun. There is so much confusion around heart problems like heart attacks, sudden cardiac arrest, arrhythmias. People use these terms interchangeably. Can you break it down for us in simple words so we know exactly what's happening and when to act fast?
Yeah, this is a very good question. What we understand, and for particularly for laymen, what we see sudden collapse is otherwise called as a sudden cardiac death, SCD, sudden cardiac death. And sudden cardiac death is because of very fast ventricular rate, heart rate. Normally, the heart rate with activity can go up to 130, 140, or 50, depending on the age. But without any reason, some people they can have a heart rate of 300, 350, which is an abnormal heartbeat where the heart effectively doesn't pump blood to the brain. That's where the patient collapses because there is no circulation, because heart is beating as 300 beats per minute. It's not pumping, it's just fibrillating or beating fast. So that is called as sudden cardiac death. And majority of the sudden cardiac death are arrhythmic death, which is known as ventricular tachycardia, yeah, ventricular fibrillation, where our ventricular rate becomes more than 300 sometimes. And there are causes for that. It could be due to blockages in the artery, majority of the cases, but it's not always true. We see many patients, females, 20, 25 years collapses in the gym or diets. This is not always because of blockages. So people should understand it's not 100% blockages always. There may be a pre-existing subclinical heart dysfunction, as Dr. Naveen was telling. The patient is unaware of that or was ignoring, or there are some genetic component. Some cardiac muscle diseases are there known as cardiomyopathies. They can present like this with slightest provocation like exercise and other things. Some footballers they die on the field. They are the fittest among the all. So for that, before doing any cardiac activities, one should have a screening, and vigorous activity one should have a screening, at least a treadmill test or a cardiac echocardiography, just to document your exercise capacity and your heart is structurally normal. That is important. Second component of death is patient have heart failure, those who are having a blockages or for some reason heart muscle disease, the heart effective pumping is 60-65%, which has reduced to 30-35%. Gradually, if you don't take proper treatment, there are better treatment available today. But if you are not consulting regularly and you are ignoring on that, your heart function can further go down and you develop a heart failure where you have breathlessness and all those things, and subsequently you die. So these are the two basic modalities of death. A majority which we are seeing sudden collapse are arrhythmic deaths, and they are because of heart rhythm disturbances, whether it's due to blockage or due to any other causes.
Right. Right. So we should be aware of sudden cardiac death.
Yeah.
And there are different reasons.
Yeah, different reasons for that. It's not always blockages.
Right. So, Dr. Amit, if someone in front of us collapses with chest pain and we suspect a heart attack, what's the first action we should take? Walk us through first 60 seconds that could save a life.
It's a very, very important question, vital question. Somebody is unresponsive. First, make sure that try to shake him up, find out whether he's responsive or not. Second, you check whether the consciousness level, if he's breathing or not. Put a finger in front of his nostril, see if he's breathing. If he's not breathing, start CPR immediately and call for help. So chest compression, 100 to 120, thumbs on the middle of your chest. BLS support is available. People should learn how to do a basic life support and call for help. The helpline number in the US is 911, but in India is 106, 112, or majority of the hospitals now, corporate hospitals, have their helpline numbers. You should have an access to any of them and call for help while you're doing a CPR. And if you have in a shopping mall or an airport, you have an AED facility, which is an automated external defibrillator. Just follow the commands, shock him, save his life. If the patient is responsive and he's having classical symptoms of chest heaviness, classical symptom does not mean I'm having pain here, pain here. If you can pinpoint a pain, it's here, it's not cardiac. Cardiac pain, you will not be able to pinpoint. 1 or 2 kgs of weight on your chest, severe sweating is going on, uneasiness, ghabrahat, bechani, those are the cardiac symptoms. And if you have that, give 325 milligram of chewable aspirin. चबा के दीजिए. अगर चबा नहीं सकते तो चम्मच में घोल के पानी से पिलाइए. उसके बाद this aspirin alone is going to save his life by about 22%. This is an NEJM WHO data. Second medicine is called clopidogrel, 75 milligram, 4 tablets. Can be given immediately. This is to be swallowed. And the third medicine is statin, which is a 40 milligram of rosuvastatin or 80 milligram of atorvastatin. Can be given immediately. All these three combined will decrease the death rate by about 44%. So all these three combined is called as a loading dose. So a loading dose in your pocket. We suggest that people who have history of heart disease or who have relatives who have a heart disease should keep it in their pocket. A loading dose in your pocket will save your life, your parents' life, your co-passenger's life, while a 500 rupee note or credit card in your pocket will not be able to do that. So keep a loading dose handy, because this is what is given by the ER doctor once the patient comes to the emergency, because time is muscle. आपको हार्ट का मरीज बिल्कुल ठीक टाइम पे ट्रीट करना है, क्योंकि हार्ट का मरीज आता भी जल्दी है, ठीक होके जाता भी जल्दी है और जाता भी जल्दी है. So that is to be, the timing is paramount.
Right. So basic life support and the loading dose,
Yeah.
right? So it's time for some quick questions, fast, spontaneous, and straight from the heart. So, Dr. Naveen, one heart healthy habit you swear by every single day.
I climb 130 to 150 steps in 90 seconds along with brisk walk of 30 minutes. That is called mini cardio blast. HIIT.
Right. If you weren't a cardiologist, what would you be doing right now?
Maybe a political leader, because both bad cholesterol and corruption need tough reforms.
Right, sir. Dr. Arun, one heart test every Indian should get done once a year. No excuse.
The basic blood biochemistry like lipid profile, the sugar values like HbA1c, and other markers are there, high sensitive CRPs, inflammatory markers. These are for sure. But if I say high risk population should get a CT evaluation, if you have 2-3 risk factor, you have a strong family background, you have some symptoms which are suggestive of maybe a cardiac issue, should get a CT or a echo. It cannot be a uniform decision, because it cannot be cost effective in a country like India, where you can get CT scan for everyone or echocardiography for everyone, where people don't have so much of finances. So that is one thing. At least blood biochemistry and clinical evaluation.
And what's your hobby or passion outside medicine that completely relaxes?
No, I love gymming. I do at least workout for 1.5 hours daily without fail.
And Sir Kapil
And
Sharma show also.
yeah, definitely. In the evening when I retire, I relax with Kapil Sharma show.
Right. So, Dr. Amit, one biggest myth about heart attack that you wish you could burst right here.
Oh yeah, especially in Gurgaon, where I practice. So people say that I'm a marathon runner. I've been running marathons, half marathons, full marathons. Yet I've had a heart disease. Yet I've had a heart attack. How is it possible? So this is, and to an extent that probably once in a fortnight we'll have a runner having an acute heart attack coming to you. So here again, magic is in the moderation. Exercise also has a J curve to it. So everything in moderation is required. When we're talking about exercise, it has to be a heady mix of three things: strength training, aerobic training. And aerobic training means push up, pull up, burpees, cross trainers, Zumba, Pilates. And the third thing is mental gymming, which is yoga, meditation, breathing exercises. So these three contribute. If you are doing it in balance, you are okay. Knowing your target heart rate, especially for the new athletes, is very important. Anybody in Gurgaon after the age of 30 who starts exercising thinking that I'm going to be my role model is my gym trainer or my competition is a Photoshop copy of a Bollywood celebrity, that is wrong. Your competition is with yourself. So you cannot be zero to hero in one day. So same way, knowing your target heart rate is important. For example, I'm 51 young. 220 minus 51 is 169. 85% of 169 is 150. So any exercise which increases my heart rate persistently beyond 150 is damaging my heart. So I have to be constantly in zone 2, zone 3 for me to be active. And yes, as Dr. Saab was alluding to, cardio burst for short spells is good. But for long term, zone 2, zone 3 is what I'm looking at.
And your guilty pleasure food, the one you can't resist even as a cardiologist.
Oh, yeah. So I really believe that moderation is the key, denial is not. I am from Jammu and Kashmir. So I like, there's a preparation called kiladi, which is a fermented cheese. I like my non-veg food. So I like tabak mas, I like a little bit of rogan josh, but then that's everything in small quantities. So that is something which you do, but I'm not a big foodie, but I like tasting everything.
So on that note, listen to your heartbeat so that it should not scream, क्योंकि हार्ट का मरीज आता भी जल्दी है और जाता भी जल्दी है. Thank you so much for
Thank you.
joining us
Thank
today.
you.